Yeah, this morning we'll be looking at monkeypox. Monkeypox. Okay, so we'll look at a number of subheadings. We'll try to look at the history of monkeypox, overview, signs and symptoms, what causes monkeypox, pathogen, recent outbreaks, as well as transmission, and of course, diagnosis, therapeutics, newer therapeutics, vaccinations, and of course, prevention if we have all the time. Now, monkeypox has something to do with Africa, we were told in time past, but I can tell you not anymore.
Wow.
Because the recent outbreaks that we're having at a global level are clusters of cases happening in people and communities or individuals with no clear travel history to Central and Western Africa, where monkeypox has been endemic over the years. What is monkeypox? What is it all about? Monkeypox is a zoonotic disease or zoonosis. Zoonotic diseases are diseases that can be transmitted from animals to man. And it's also a viral infection. Like all other viral infections, a handful of them actually self-limited or self-limiting, which means that if you pick some of them up, with or without treatment or therapy, they may resolve. Okay? And monkeypox falls in that category. What is unique about the monkeypox? But first, let's look at the history. The first time monkeypox was isolated was in the year 1958. Some monkeys that were reserved for clinical research purposes were discovered to be infected with this disease. And at that time, it was only a disease that affected animals only. It wasn't until 1970 when a 9-month-old baby was said to have been infected with monkeypox. That was the first time.
That was in 1970.
1970 in Congo DR in Africa. So that was the first time that monkeypox was reported in humans. And ever since then, it is a well-known fact that some regions in Africa, precisely West and Central Africa, are known to be endemic to monkeypox. What that means is that from year to year, we grapple with clusters of outbreaks of monkeypox in one country or the other. About 11 African countries have been affected. And of course, there are two distinct clades of monkeypox. Two distinct clades, or two distinct variants, if you like. Now, the clade that is found in Central Africa is known to be the virulent type, the more virulent type, okay, in Congo Basin. While the one that is found, the clade that is found in West Africa, is a more non-virulent, not as much as the one that is found in DR Congo and some other part of our African countries. It's only one country that have two clades, two distinct clades. Only one country is only in Cameroon that two distinct clades have been found. And the one that is suspected to be causing the outbreaks that we're having in some Western world as of today is known to be the milder type, the West African clade. That is the one that is causing the ongoing outbreaks. Initially, before now, the outbreaks that we used to have had to do with cases of travel. The first time that there was an outbreak of monkeypox outside African region was in the year 2003. Okay? Now, that happened in the US and affected, it recorded about 70 or more cases at that time. What happened? Some animals that were imported into US, some animals that were imported into US were said to have come in contact with Gambian rodents that are known to have this monkeypox. Okay, so sort of contamination. And of course, from that, got transmitted to humans. And of course, apart from that, it is a zoonotic disease. You also could have human-to-human transmission. Okay, so when we talk more about transmission, we'll be able to find out that. Okay, now we know about smallpox that has been eradicated globally due to widespread containment measures that were instituted at the time it existed. And as of today, smallpox does not exist, at least in natural forms. Okay, only in laboratory stored forms that you can still have that today.
So you can't physically see someone that has.
Yes, smallpox anymore, but it has been eradicated.
Okay, good.
Okay, as far back as about 52 years ago.
Wow.
Okay, now I mentioned smallpox because there appears to be a lot of similarities between smallpox and monkeypox. Okay, monkeypox belongs to, I've said initially that is a type of virus, is a viral disease, and it belongs to a genus called Orthopus virus from the family of Pus viridae. Okay? Forget about that. Those are just medical jargon. But just know that it is a viral infection. That is what is important.
That's all, yes.
Okay? And it can be transmitted from animals to humans, and of course, person to person, human to person, humans. Okay, so that's a bit about the pathogen. Now, let's talk about what makes monkeypox unique. The presentation of monkeypox may be similar to all other rash-causing illnesses like chickenpox, okay, and some other ones. Measles too are in that category. But in monkeypox, there's something unique about monkeypox. In medicine, we say pathognomonic, meaning specific about a particular infection. The development of lymph nodes, enlarged lymphadenopathy. Lymph nodes are usually when you have an injury on your hands or legs, you discover that you may have a swelling on your armpit. If the injury is on this part of the hand, if on the left you have a swelling here, on the thigh you could have along the line of the upper thigh. Those are called lymph nodes. Okay, but when you have multiples of them, okay, swollen and painful, you should be thinking about monkeypox.
And when they are not just on those places you mentioned again.
Yes, they could be on the neck.
Yes.
Okay, so because actually the signs and symptoms of monkeypox can be divided into two. The first stage, the invasion stage, and of course the second stage. The invasion stage will actually come with fever, high-grade fever. In some cases, it could come with weakness, asthenia. It could come with that severe weakness. It could come with muscular pains, myalgia. It could come with some other symptoms. Okay, but what is unique is that the fever, the prodromal phase, the fever stage may take about 1 to 3 days, and afterwards, you now start having skin eruption, which is the second stage of presentation. And that is about the time you start having eruptions, those unique eruptions that usually follow a pattern, which I'm going to talk about shortly. Okay, now those eruptions are usually more on the faces. 95% of cases, the eruptions will be more on the face. Okay, the limbs, upper and lower limbs, talking about the hands and the legs, will have 75%, will have about 75%. It also affects the eyes, because in some people, some of the complications that can occur with monkeypox is that it can cause complications in the eyes that oftentimes may lead to blindness. Now, in trying to compare monkeypox with smallpox, the two are similar in a number of respects, but the virulence of smallpox cannot be compared with that of monkeypox. Monkeypox is actually lesser. Okay, so the case fatality for monkeypox is said to be between 0 to 11. Okay, I also would like to talk about the incubation period of monkeypox. The incubation period is the time of peaking infection to the time the disease begins, the signs and symptoms begin to manifest. Okay, so that is the incubation period. For monkeypox, the incubation period is between 6 to 13 days. It could also range from 5 to 21 days in some cases. Okay, so now back to signs and symptoms of monkeypox. Now, the eruptions, the skin rash that is typical of monkeypox, we usually start with small flattened rash called macules. Okay, you could have elevated elevated, flattened rash that are called pustules. Okay? Now, it could also go further to have vesicles, which could contain clear fluid. Okay? And then the last one should be pustules, which will contain yellowish colored fluid. And after the development of pustules, you could now have scabs formation and crusts being formed. And this could happen over a period of 1 to 2 weeks or more. In cases where you need to do investigation, carry out investigation, some of these fluid samples are actually what you're going to use. Or some of the crusts are actually what you're going to use to carry out investigations that can actually help you to diagnose the disease. Okay, so that unique eruptions that we usually find, that are usually found on the faces of people, multiples, sometimes it could be in thousands, are very, very unique. Okay, once you have that coexisting with significant lymphadenopathy, you should be thinking of monkeypox in such an individual. That will rule it out from other similar rash-causing illnesses like measles, chickenpox, and what have you. Okay, so apart from that, let's talk about the transmission, which of course we have talked briefly about. I've said that the transmission could be from animals to man, and of course it could be from person to person. Pregnant women can actually transmit, yes, the monkeypox to their unborn child, okay? In which case you could have congenital monkeypox. It could also be transmitted from mothers who have delivered to the babies that they are breastfeeding, okay? Recently, the outbreaks that we have had that occurred in a number of places in the Western world have been traced to a group of people, men who have sexual exposure with males.
Wow. Okay?
The scientific community are beginning to look whether it has a sexual transmission route. Okay, but the evidences at hand suggest that it may not actually be a sexual transmission route, so to say, but because of the break or breaches in skin, okay, that could occur when one is exposed to such coital exposure, can actually lead to skin and close contact, which could actually be the reason why some of those people in that category are catching it.
Videos I've watched, doctor, should I say, it wasn't really talked about where it started from. Okay, so now one of the questions we me asked, and I was hoping I was going to see the answer right there in the video. Okay, so should we say it's an African thing? Because in your discussion, you said that it has something to do with Africa, but not anymore. So what do you mean by that statement? Was it discovered in Africa, or I don't know?
Yeah, thank you very much for that very good question. The 1958, some of the accounts I've read, I can't actually place any nation of the world where they had those monkeys for research. But I can tell you that may not be in Africa. Research at that time with monkeys, we may not have gotten to that level. Okay, but the one we know in accordance with history is the fact that the first place it was picked out was in a 9-month-old infant, okay, who was infected with monkeypox in the year 1970. Don't forget, the vaccine, the smallpox vaccine that was used, observational studies have actually shown that the smallpox vaccines that we used at that time are still 85% effective now. Okay? Now, but smallpox vaccines are no longer in use because of the fact that smallpox has been eradicated some 52 years ago. So people who are older than 52 years may be immune to this monkeypox that we are talking about. So that means those people who have gotten the jab, okay, we expect that to be people who are older than 50, who are 52 and older. But for people who are much younger, who weren't opportune to get that smallpox jab, okay, then it's being suggested in some circle that if you have family members and you probably have somebody who has been infected with monkeypox, that you should have the older, the senior citizens in the house monitor and take care of the person, because they are expected to have been, they are expected to have been vaccinated many decades ago. That jab is actually the one that shows a black mark on our shoulder.
Doctor, we have Eric.
Yes, Eric from Enugu. Good morning.
Good morning, Eric.
Are you there?
It's gone. Okay. Please feel free to call us back.
So those people who were opportune to get those jabs, those vaccines at that time, okay, so today they have some benefits from it. For much younger people like you,
me,
you are at risk without any iota of doubt.
Really?
Yes.
Okay, sir.
But yes, still about that. That's the only documented history we can actually lay hands on. But ever since then, it is a well-known documented fact that it has been endemic only in Africa. Central and West African sub-regions, precisely. Okay, it has been found in about 11 to 15 countries in Africa. And then not anymore, because all other parts of the world, it can occur anywhere, because people can travel from point A to point B and then export it from one region to the other. And that is why the world is, that is why it's a public health disease of global importance. So everybody is focusing on it.
Okay, let's take James from Taraba. Hi, James. Good morning. Hello, James.
Hello?
Good morning. Turn down your volume. Wow, what's going on with our numbers this morning? Please keep trying, I beg. I know say before we come out here, definitely it will connect. Doctor, please come.
Yes, sir. So that's why, okay, so these are places where monkeypox are known to be endemic from year to year. For instance, in the last 10 years, we have been having issues with monkeypox, clusters, sporadic cases springing up here and there, usually at a particular season. I also would like to add that areas where you have rainforest region, forested areas, towns around that vicinity, where you have a lot of rodents are actually implicated. And of course, in this part of the world, you can't shy away from the fact that we use some of these rodents as sources for meat.
Bushmeat, I was almost going there. I was almost going there, doctor.
Okay, so bushmeat. This is not a time that anybody should be dealing with, because you can't actually say the one that is affected, an animal that is affected or not. Rope squirrels have been known to carry the disease. Tree squirrels have been known to carry the disease, not just monkey. In fact, there's even a debate that the disease may not have originated from monkey, that it is unclear the primary host, where it actually originated from. But it's a well-known fact that rodents have it. And we have two distinctive clades that are circulating in the population. The one in West African sub-region appears to be the Maida type, which is actually the one that is responsible for the current outbreaks of clusters of cases in parts of Europe, America, and Canada. Okay, but the more virulent type, which is the Central African clade, which is actually found in parts of Congo DR and some other places, okay, is actually said to be the virulent type. Two of them are actually found in Cameroon, okay. So when we talk about outbreaks, the only one that stands out was the one that happened in the year 2003, when about 70 people were said to have been affected in the US, just because they took animals from Ghana, our neighbor here. Those animals were taken from Ghana to the US. Those animals that were said to have been contaminated with Gambian poached rats, okay, or poached rodents. From that, it got transmitted from one individual, and again, it started spreading. It can actually spread. The longest chain of person-to-person transmission is said to be between 6 to 9 individuals. Okay, so that's about that. Then, talking about the transmission, we said at the beginning that it is not just animals to human transmission, that vertical transmission can also occur, in which case a mother can transmit it to an unborn child. Okay, signs and symptoms, we have talked about that. We have said that the signs and symptoms are usually subdivided into two. Okay, the early symptoms, which is the prodromal phase, characterized by high-grade fever, okay, weakness, severe weakness, muscular pains, myalgia, if you like. And then this will happen over a period of 1 to 3 days. So if you see anybody that is having fever without the eruption of rash, please, you need to be careful. High index of suspicion is advised, particularly for healthcare workers. These are people who get exposed.
Okay.
Some of the ways through which this transmission can happen is through respiratory droplets, something similar to what you have in COVID. But in this case, you need to have been exposed for a much more prolonged period of time with an individual before you can actually have that. Okay, so the virus also can contaminate beddings where you have sick individual. John from Ebonyi. Good morning, sir.
Hello, good morning. How are you?
I'm fine, thank you.
Please, I'm asking, is monkeypox same like chickenpox or smallpox?
No, sir. They are related, but they are not the same thing. Smallpox at this time has been eradicated. Okay, smallpox has been eradicated about 52 years ago globally. Okay, so we don't have smallpox anymore. But monkeypox and smallpox are somehow related in terms of signs and symptoms, but there are features that distinguish monkeypox from smallpox, okay, which have said to the development of significant lymphadenopathy. When you have lymph nodes getting swollen in some parts of the body, usually the head and neck, okay, that was not found in symptoms of smallpox when it existed though. Okay, so
we're not praying for it to come back.
we're not.
But anyways, let me just add to. I want to also ask a question towards what you just said. Okay, because you mentioned the fact that smallpox was actually eradicated 50-something years ago.
Yes.
And I think you also talked about the fact that it is actually more dangerous than monkeypox.
It was killing a lot of people.
Then. Okay, so should we say that
had about 30% case fatality?
Okay, so is there any possibility of monkeypox being eradicated too? You know, just the way smallpox was eradicated. Then I want to ask, since in the video I saw them talked about maybe being in a closed space, you know, face to face and all that. Should we start talking about face masks, social distancing now that we have monkeypox outbreak?
No. Now the reason why we may not go that far is the fact that, like I said at the beginning, monkeypox is self-limited. Okay. It's not all the people that have it that will come down with severe disease. Okay. Self-limited in the sense that sometimes if you do nothing when you have a self-limiting viral infection, it could go away over time, over a period of time. Okay, so a whole lot will have milder disease which can go away. As of now, it has got no treatment. Okay, so the much you can do is to put up a symptomatic treatment to tackle the symptoms, tackle the complications. But that does not mean that it is not deadly. It can kill, and a whole lot of people have actually died as a result of this, particularly children, people who are much, much younger. Okay? So it can actually happen in them. Okay. Now, I was talking about I wanted to go give a lot more detail about the signs and symptoms, and I said you usually start with fever, which could happen over a space of 1 to 3 days. After that, you now have skin eruptions. The skin eruptions follow a particular sequelae, okay? It usually comes after like 3 days when the individual must have had fever, weakness, headache, and all whatnot. You now start having skin eruptions, more concentrated on the face. 95% of times, you have a lot of concentration of it on the individual's face. Okay, now, this rash, we call it lesions. Okay, they occur in a unique pattern. They follow a particular sequence. First, it starts with macule. Macule is a flattened rash. They are flat, the same level with your skin. After that, it goes to papules. Papules are a bit elevated, where you have like swelling, bumps scattered all over the skin, all over the hands. Okay, so after that papules, it moves over to the next stage, which is vesicles. Those vesicles will contain clear fluid, okay? Get swollen, and then they start getting busted. And the individual will start having septic spots all over the body, like wounds all over the body, oftentimes may have odor. And then after that, vesicles have been formed. The next stage will be pustules. That pustules will contain yellowish colored, sometimes pus. Okay, so that's about towards the last stage. And after the pustules, you now have pus forming there, opening up and busting and all whatnot, messing up the whole place before you now start having the dried scabs and crust. These are some of the things that can be taken for the investigation. So it has a pattern. It can easily be picked out. If you have somebody who has developed some of these things, you need to be careful. You need to have a high index of suspicion. About a month ago, I encountered one in my hospital. As soon as I saw the person, I asked the nurses not to take the vital signs. Because if you use Sphic for such an individual and you probably use it in another person, you are increasing the risk of the person getting to. I said, usually they know. Once you have anybody presenting with rash, you don't do vital signs. The much you can do is to use the non-contact instruments, okay? You don't do anything that will come in contact with the person's body. In cases where you must do, you may need to put a covering on the hand before you can actually take the blood pressure. In some cases where you need to do that. And of course, I had to meet the person in a wider space, consulted, and they did the appropriate thing and referred the person to a center where they have capacity to manage such diseases. Because it's not everybody hospital that has what it takes to manage this disease, okay? Because of the way it can spread. Talking about diagnosis, how do you make a diagnosis of monkeypox in a hospital setting? Okay, so like I said, it starts with a high index of suspicion. The healthcare practitioners or givers should have a high index of suspicion, okay, because usually they're the frontline people, they're the ones that can actually pick this infection from people. We have seen a number of cases of that happening in our environment here. Okay, so the gold standard for diagnosis of monkeypox is through PCR, something similar to how COVID is tested. Polymerase chain reaction test. Okay, so that is the gold standard that I can actually give you, identify and give you. It's very sensitive. It gives the accurate result that you need to work with. Apart from that, there are some other antibody antigen tests that could be used, but they are non-specific. They can actually give you false positive results. For instance, somebody who has been vaccinated for smallpox, if you conduct a test for monkeypox for such an individual using an antigen antibody-based testing method, it could give you a positive result because of the previous vaccination the person had, some 52 years and above number of years ago. Okay, but not for younger generation anyway. Okay, so the gold standard is that. And then I also would like to talk more about the sample collection, okay? The samples can be taken from the crustals, from the pustules, from the skin lesions, okay? But when these samples are taken, they must be packaged in WHO recommended standard. Triple bagging needs to be done. You need to put it into 3 sets of bags to protect, because there are patterns, there are recommended ways of transporting hazardous, dangerous health materials from point A to point B before it could be sent to the appropriate lab where they have the capacity and capability to carry out those tests. It's not everybody that can do PCR tests, and I'm happy COVID-19 has actually helped us to upgrade our facilities here in Nigeria. We have tens of hundreds of places in Nigeria today where we can do PCR tests. A few years ago, we used to transport our samples, Nigerian samples, to countries like Senegal to help us out. But that's not anymore now. Okay, so those are some of the benefits that we've been able to derive from the battle that we have to do with COVID-19 pandemic. Okay, talking about therapeutics treatment, I said at the beginning that what can be done now at best is symptomatic treatment. But that is not to say that the scientific community are not making effort to find therapeutics, drugs that can actually make a difference. One important drug has been discovered and has received an approval. Is called tecovirimat. Okay, this antiviral agent can actually be used to treat monkeypox in some situations, but they are not widely or easily available in this part of the world. So what you and I will need to pay more attention is prevention, prevention. Of course, that's why we are doing this, raising awareness, giving you ideas of how you can identify this when you see individuals who have it and what to do. Okay. Still on therapeutics, vaccines too can be used.
Do you have vaccines for it?
Yes, I've said somewhere along the line that observational studies have shown that vaccine that was previously used for smallpox to eradicate smallpox for the global containment of smallpox that was so successful can actually prevent one from having, not like the vaccines we have for COVID. In which case you have to take first dose, second dose, booster dose. Booster dose.
Wow.
Doses. Okay, so but this vaccine has been very effective, 85% effective. Wow. Okay, if you take it, you're not likely to, your chance of probably getting the infection is reduced. Okay. The odds of getting the infection is reduced up to 15%. So 85%, you're good to go. Okay, those vaccines were used in time past for smallpox, and U.S. has a good stockpile of that vaccine, just in case smallpox emerges.
They are ready to fire.
Yes, accidentally from the lab or from any place at all. Okay, because we said that smallpox are no longer naturally existing. It has been eradicated, but U.S. has a stock.
But they always do research.
Yes, U.S. has some way they kept theirs. Russia too has some way where they kept theirs in laboratory formats, which cannot be released. But if you have accidents in some of those places, we're back to square one. Okay, so but we don't pray that happens. So for vaccine, there are newer vaccines that are being developed too that could be very, very useful. Okay, but that said, people who were immunized when those vaccines were available have some degree of protection still in them up to this moment. And that is why we advise that if you have somebody who has smallpox and it has been proven that such a person has smallpox, you should look for older citizens in the house to come closer and give a helping hand in taking care of the person.
Avoid stories.
Yeah, avoid stories. So, but emphasis, like we say, should be made on prevention. And how do we do this in our environment? We need to avoid as much as possible resorting to bush meat as a source of protein.
But doctor, what is it with animals and diseases? Seriously, this is not like the first time we have to stay away from one particular one, and now you're coming with
a whole lot of a whole lot of diseases are actually found in animals. A whole lot of diseases are actually found in animals, and you have a lot of zoonotic disease. COVID-19 is also a good example of a zoonotic disease. Okay, that scientific community believe that it emanated from animal and then jumped to another species, humans in this time. Okay, so those are some of the things that we need to look at. Okay, so but what is the World Health Organization doing to help countries of the world? They are doing a whole lot in areas of helping countries to do surveillance, keep data that can be used for research purposes. Beyond that, they're also assisting in areas of therapeutics and diagnostics, because if you're unable to, that's why you usually hear suspected cases, confirmed cases. Okay, so there's usually suspected cases and confirmed cases. Yes, when they have done the useful or the needed test that one will need to go through.
Okay, but doctor, we are definitely going to continue next week.
Obviously.
Okay, so we are just getting started. So next week, come with your barrel, come with your jotter, be like me, and be prepared to ask questions. Thank you so much, doctor.
Thank you very much.
I'll see you guys on Top 5.
So see you again next week.
But I'll see you 1 to 2.
Thank you.
Bye, guys.
Slimmest of them all.
Thank you, doctor.
So nice reuniting with you.
Yeah, same here.